Assalamu alaikum. This is a salutation in my country, Pakistan, and it means that peace be upon everybody, and everybody stay blessed, whosoever is in this audience. Um, my name is Shahla Sohail, and I live in Lahore in Pakistan, and I've led a life with von Willebrand's disease, and today I was asked to present the unexpected life that I've led in this country, and how I've crossed many hurdles, and I wanted to share it with you, and so here we go. All this started about more than half a century ago, because at that point in time, my parents, who were first cousins, got married, which is perfectly normal in this part of the world. They were overjoyed, over the moon, and were quite happy. Their love was unconditional, and I started to grow unaware of my destiny. Everybody thought I was quite healthy, and it was much later that things begin to happen. My first brush with hemophilia was when I was about a couple of years old. In fact, my mother says that you were about 1.5 years and were taking your first few steps, learning to walk. And it was then that I tripped over and I cut my lip. My mother noticed that this was more than normal bleeding, and so she didn't panic at that point in time, and did all the first aid that she could think of, compressing it, applying ice to it, and holding me tight against her, but nothing worked. And it so happened that I bled till it was about 4 or 5 years later, and at that point then she called up my father, and they both thought that we should be taking this baby to the hospital. So off we went to the hospital, and when we arrived there in the emergency room, the doctors thought that okay, if she's bleeding, that's one thing. But at this point, I had become very pale and listless. So they did the HB, and they said that it was very low. So they wanted me to be resuscitated first with a blood infusion, and then later on see as to what to be done about me. I was transfused with the whole blood, which was donated to me by my father. And this was the first time of many times that he later on donated blood to me. So that was that. And then when my parents kept on noticing that the cuts and the bruises that I used to have were more than usual, that they could see in other children. So again, they took me to a doctor in the hospital, and who said that, okay, I don't see much point in doing the test, but I'll do the test just in case. I just think your daughter is very active, and she keeps on bumping into things and that, this and that. So when he did a very basic test, which was a bleeding time, and that was very prolonged, unusually long, more than about 18 minutes, and then they had to stop the test because the bleeding just continued. At that point, they came and then talked to my parents, and they told them that your daughter has an abnormal bleeding disorder. So that was the diagnosis, and my parents were devastated because the word abnormality is petrifying in this part of the world, where disabilities are not accepted at all. Anybody who has an abnormality is just not human enough, if I may say so. So they began to think about it, and they went to a few other doctors for opinions, but it was no help. So my father applied for a compassionate leave from the army, sold off a little bit of his property, and he took me and my mom abroad for a checkup, medical checkup. And it was at the age of 6 or 7 that I was told that I had a von Willebrand's disease, which of course was a very weird word for my parents to find out, an unusual bleeding disorder. So they were told that, oh, it's just a bleeding disorder, and probably she's inherited it because you were both cousins. And as far as the treatment goes, all you need to do is to give her fresh blood at point in times when it's needed, or plasma. So they came back. Now, at this point in time, they decided that because the word abnormality had stuck in their minds, so they thought that they needed to pay more attention to that. So they said, okay, fine. They enrolled me in a good school, and thought that, okay, if our daughter is educated enough so that she may go into a profession or some sort and lead a life of independence, dignity, integrity, and so that's what they started to concentrate on about my upbringing. So days went by, and I went through my school. I did quite well in school, and I enrolled into a college, which was pre-medical. That I was, because I'd been so much in and out of hospitals, that I admired the doctors who were there, and I wanted to become a doctor. And it was quite easy for me to get into a very prestigious medical school. Graduated after 5 years as MBBS, and then I was interested in children, so I did pediatrics over there, and then we had a discussion with my parents and to think as to what to do next. That was when I was 23 years old, and the girls of my age were, all settling down, getting married, having children, and that, and the other. But as I said, abnormality or a disability is not acceptable in my culture. At that point, my parents said that, okay, marrying me off was not an option, and my father offered me the money that he had, or whatever that he had made as my inheritance, and he said, you can take your dowry money, and I think you should go abroad and have yourself properly diagnosed and treated, and see how it goes, and then we'll go on from there. So I packed my bags and I went to the UK. I started to work over there, and in the meantime, I was enrolled into a HTC in Manchester, where, of course, my diagnostic workup was done again, and I was found to be 1 Willebrand's disease type 3, which was quite severe. But life moved on, and I continued to do my post graduations, and then another destiny took another turn. In 1983, I met my husband, who is a doctor and an orthopedic surgeon, and he was there doing his post graduation, where I was doing mine in pediatrics. As life would have it, we ended up and getting married, but this was after quite a lot of deliberations, because of the fact that I was very scared as to what will happen after getting married, with your reproduction life or your marital relations. There was a lot of queries in my mind. So I consulted a geneticist, so that we could, find out more about the ramifications of my bleeding disorder and how my life would shape up after that. So he said that it was quite normal for people with women with von Willebrand's disease to have children there and be safe, and have a safe delivery and a safe pregnancy. So, but he said, you will have to be very careful about it. So we planned a family, and 2 years after my marriage, my daughter was born. We were overjoyed at that point, and quite happily. The delivery went okay, and it was on the 10th day of my postpartum period that a sudden profuse hemorrhage happened, which was like I collapsed within a few hours after the start of that hemorrhage. So then everybody started running, and I was being treated with cryoprecipitates and FFPs, which were just doing no good. And another few days, 4 or 5 days later, they did tested me for inhibitors, and I had developed inhibitors to 1 milligram factor. So again, those were very difficult days because there was really no alternate treatment if a person did develop inhibitors. All this continued, and they tried the various techniques or various medications that they could think of. And in the meantime, about 6 to 8 weeks had passed where I'd hemorrhaged all through it. I had numerous bags of FFP and about 100 units of blood and what have you. So it was troublesome, it was difficult, it was sad. But then suddenly after the puerperial period, they tried some hormones and that did work. And so at the end of the day, they couldn't put a finger as to what did it stop. But they had already stopped the cryo because of the inhibitors. So finally, I took my baby and I was discharged, but I had to follow a strict regime of follow-up for monitoring the inhibitors. So every 2-3 weeks, I had to attend the hospital. Uh, After about a month at home, when I was hardly, trying to enjoy my baby, and I was like more relaxed at that time, a phone call from the hematology department effectively put an end to it and said that the lot of few intermediary purified factor VIII concentrate, which was very new at that time, that we tried on you, have been found to have HIV contamination. So can you come back in for your HIV status to be assessed? Now that was devastating. I had to rush back to the hospital with my baby, and they were asking me questions as to are you feeling weak? Did you have any fever? Are there any cold sweats? Do you have any lymph nodes here, there? And then they took my sample and they said, okay, we'll give you a report after 2 days. Those 2 days were hell. After that, when the reports came in and they said, okay, you're not seroconverted, you're still negative for HIV, and good luck to you, but we'll have to look at it again after 6 months. So I came back again, and life began to move on. And so after 6 weeks, they 6 months again, they tested it, and it was negative. In the meantime, my daughter was found to be a carrier, but she was fine, healthy, and I enjoyed her immensely. We tracked back home after about a year after my daughter was about a year old, and we came back to Pakistan, and things began to fall in place. But as soon as we came here, I found that Pakistan was still where it was about so many years ago. Still, there was no hemophilia care. This was in the 90s and nearly in the year 2000. So a few friends and colleagues and peers, we got together, because at that time everybody was quite established and earning and what have you. So we decided to put something back to the society, and everybody gave me a look and said, do we want to start hemophilia care in this country? And that was the initiation of part of the Hemophilia Patients Welfare Society of Pakistan. I, being a doctor and a patient, was the key person in that setup. So we started enrolling patients, and things began to move, started fund collection. The government, of course, didn't support it, not even till today, because they think it's too expensive and not worth it. So we got enrolled and recognized by the WFH as an NMO, and we started to get some humanitarian aid, worked really hard so that we could put to use every little bit that we had gotten as a humanitarian aid. And from then on, it's been 20 years. I'm still head the Hemophilia Patients Welfare Society, and at this point we have about 950 patients in Lahore alone. We've spread to the other provinces as well, and things have improved a lot for the people. In my mind, I'm always thinking that I'll work, full time as a volunteer in this organization, and I've done so since the last 20 years. And I just don't want anybody to go through that I had been through. So I've got the inhibitors are still there, and so my treatment modality is Novo 7, and Novo 7 is very expensive and it's not available in Pakistan. So my friends all over the world, they whenever they have a few vials to spare or something or the other, they start shipping some of them to me as personal medications. So that's how I survive, and that's how I'm living my life with hemophilia still. Um, now, what do I do in this organization is, of course, I'm a medical practitioner, I'm a doctor, so that is one thing. But apart from that, I am a counselor, a family counselor, I am a genetic counselor, I am a social worker, I am a support system for the families. I sort out their psychosocial issues. People come to me for advice and treat me as somebody special who can, play God with their problems. So that's what I do again. They expect me to make their decisions. And whenever they see me, all the girls with von Willebrand disease, with menorrhagias, who I keep registering, I've got about 88 of them. When they're talking and they're so worried about the periods and they think that daughter is going to die, and the first thing I tell them that, look, if I've survived in very minimal treatment facilities, this is a good facility for you, and I'm here for you, to guide you and tell you and diagnose your daughter, and if I can make it, she can make it. But the thing is, do give her the opportunity to be very well educated, be independent, and live a life of dignity and integrity like myself. I'm grateful to God for whatever He's given me, and I think that when I used to be in hospitals, those multiple times, I used to think, oh my God, man, it's better to die than be in and out like this. But now I know why I survived everything, and maybe it was somewhere up there, somebody up there who decided for me the destiny that I've led, to be a part of the care that the persons with bleeding disorders, especially the women and the girls, need. Maybe I'm the person who can make way for them and provide it for them. So I'm very grateful to God, and I think that's about it. Thank you all for your patient hearing, and goodbye.